All right, welcome back. Dr. Saeed, with South Texas Bone and Joint Institute, was the first to perform the first ever robotic-assisted total knee replacement using X-ray technology, and it's here in San Antonio, and he's here to tell you more on what it is and who's a good candidate for this. And this is an important topic right here, especially when it comes to your knees, being mobile.
Yes, and thank you very much for having me on the segment today.
Well, we're glad you're here today. So what is your background and training when it comes to this area, Doctor?
So I did my residency training at the Mayo Clinic in Rochester, Minnesota, and then I went on, I was the chief of orthopedic surgery at Andrews Air Force Base. Then I did a fellowship in joint replacement surgery in Baltimore, Maryland at the Rubin Institute, and the Air Force brought me down here, and then I was stationed at Wolford Hall. I ran the joint replacement program for the Air Force out of San Antonio. My wife and I loved it, so we just settled here and called it home, and then we started the practice here. But our goal is to make our practice the premier total joint replacement practice here in San Antonio.
Well, we're glad you call San Antonio home. We really appreciate you, especially with your background and your service. So what is the total joint robot, and how is it different, the ROSA, excuse me, and how is it different from other surgeries when people are out there looking for different avenues?
So the ROSA is a robotic arm. It's a robot that we use during surgery. It assists me. The human is in control of the actual, the actual robot.
Okay.
Other robots that are out there, the actual robot is the one doing the saw cuts, but here the human's in control, so the expertise and training are very, very important. I do have a master's degree in electrical engineering, so it helps me understand the mechanics of the robot better than an average orthopedic surgeon.
You know, there's a lot of people that are out there that do need knee replacements. How is it important for them to do their homework and look at something like this?
Sure. So, obviously you talk to your surgeon. The robot specifically does allow for more precision of cuts, and it's been shown to increase the precision compared to standard instruments that we have now. And I'm actually the only ROSA certified surgeon in the San Antonio area in South Texas.
Wow.
So, yeah.
And the recovery time, it varies, obviously.
It varies, and it is patient dependent, but my average is 4 to 6 weeks on recovery after knee replacement surgery.
Very, very cool. All right, doctor, thank you so much. Let me give everybody the information that they need. So if you're out there looking and you need some options, this is where you need to go, because this is the only guy who can do it. South Texas Bone and Joint Institute. They're here in San Antonio, Texas. They're at 5510B Prasado Parkway, Suite 2401. Give them a call, 210-696-2663. Or go to southtexasbone.com. You can even find them on Facebook as well, STX Bone and Joint. All right, everyone.